Hello everyone, I am Dr. Srinivas, practicing urologist at Asian Institute of Nephrology and Urology, Hyderabad. So today we will be discussing briefly about urinary tract infections in children. So why this topic is important? Because infections are common in children and they are often diagnosis is missed and underlying problems are also missed several times and babies come to us at a very late stage. So first, how do these children present when they have infections? There is a wide variety of symptoms like children may cry while passing urine, or they may have blood in urine, or they may have recurrent attacks of fever, or there may be inability to gain weight. Any of these symptoms could be because of an underlying urinary tract infection. So when you take your baby to a pediatrician, he evaluates and says the baby has an infection, and they often refer to us urologists. Now let us see what are the various causes of infections. So there are certain causes which are common in male children, there are certain causes which are common in female children. So when you come to male children, and there are certain causes which are common to both. So coming to the male children causes, the skin on the penis may not go back and totally block the urine passage and cause infections. The children presents with crying while passing urine and swelling of the penis tip while passing urine. So this condition is called as phimosis, and it can be cured with a small surgery called circumcision, which is done generally on a daycare basis. Then other cause, any blocks in the urine passage, the urethra. The most common cause is a problem called posterior urethral valves. So there is a block in the urethra which is from birth, and this reduces the urine flow. This valve has to be detected on time, and it has to be treated with a laser operation. Suppose we miss this problem of the valve, it can have a devastating problems for your child and ending up to kidney failure. So this we have to be very careful. And there are certain causes which are common both to the girls and boys. One common cause is called as vesico-ureteric reflux. The urinary system generally consists of two kidneys, from which urine is carried through a narrow tubes called ureters into a bladder. And from the bladder, we pass the urine through urethra. This is generally a unidirectional flow from the kidneys through the ureters to the bladder and to the urethra outside. So what will happen is, when the valves which provide unidirectional flow fail, whenever the child attempts to pass urine, the urine is pushed back to the kidneys in the reverse direction. This is called vesico-ureteric reflux. And based upon the severity of this reflux, the child can maybe having a simple UTIs, or they may have, it may end up in a kidney infections and kidney failure also. So this condition we have to be very careful, and because it can be a totally treatable condition, it should not be missed. So how do we find out this, whether the child has a reflux or not? So once the acute infection is treated, when we have a doubt that child can have a reflux, we ask for an X-ray called MCUG, micturating cystourethrogram. So this will give us an idea whether there is reflux is there or not, and if at all, if it is there, what is the grade of the reflux. So this reflux has got several grades. So the parents should not get panicky when they come to know that their child has a reflux, because this reflux can be totally treated. If it is in the grade 1 or grade 2, it can be controlled with medicines, and if it is grade 4 or grade 5, we can offer a surgery to the child. But whatever treatment we do, it is very mandatory for the parents to keep the child on follow-up and come and visit us periodically till we confirm that the reflux is cured. In addition to these, there are certain additional problems in the kidneys like pelvic-ureteric junction obstruction. So this is the problem where urine fails to descend from the kidneys into the bladder. There are blocks there. So this condition, if diagnosed, it has to be diagnosed and operated if needed. And in all these cases, please remember, follow-up is very important. So majority of the times the parents fail to turn up for the follow-up since the child is alright after the initial treatment. So this sometimes can lead to a serious problems like removal of the kidney or kidney failure also. So please do remember and be on follow-up with your doctor and go as and when he advised. So till when, next question is, till how long will you call us for follow-up? So number one, till we are satisfied that the infection is cured, until we are satisfied that underlying problem is treated. This sometimes may take a few years of follow-up. Initially, we call you maybe after a month or 3 months, and gradually this follow-up is extended up to annually. So please be on follow-up and protect your child's kidneys and bladder. Thank you.